With us today, a 54-year-old patient. We can see a normal pattern of aging when she's losing tensile of the skin. We can see some void of bone and of fat. We can see that the malar area here is quite empty. The deep nasolabial fold and the angle of the mouth here and under in the marionette area is also with a void. We would like to restore some volume and to augmentate and to lift. We will inject to the upper part of the cheek, to the malar area with some more soft material. We will inject the nasolabial and the marionette. Later on we will inject with cannula the line of the jaw, and we would like also to restore some volume back to the lower part of the cheek. So let's start to work. Okay, I'm injecting Hydraulix Ultra to augmentate the area of the zygoma. 1 point, 0.45. She lost a lot of volume. I need at least one more point of lifting. I will inject also upper on the zygoma temporal joint around 0.3. Never forget to aspirate. We don't want to inject into a blood vessel. And until the bone to aspirate and to inject. I'm injecting Hydraulix Ultra, good material with a very good lifting capacity. It's wonderful to inject it just against the bone and to get augmentation and lifting. And now I can go further. Okay, pre-hole for the cannula. Entering with the cannula. Always putting my finger, the chayavim. We have to. We don't want the material to infiltrate to the lip. The till here it's quite okay, but because of the void in the middle part, we would like to inject on the line that it will look a little bit more soft. To remember that quite big vein is passing here, so we want to be maybe too lateral to it to inject a pre-hole needle above the lower part of the mandible, not to meet the big vessels. What you need to remember is that when you enter, you need to try to be very deep on the bone here. I apologize for the pen. Feel that we are really in the middle part of the chin, and then to start to inject. Okay, now we can see that we are in the right place. We'll keep injecting. Okay, it's enough. All what I need to do now is to massage it against bone. Okay, that looks much better. The next thing to do is from the same hole to inject to the void here. So I need first to enter, and just after I enter, I can strike my hand, and then to find my direction to the area I want to inject. The issue with the cannula is when we are doing the pre-hole, we are entering through the connective tissue and we are creating a port of entry in a specific direction. So if I put the needle here, I will not be able to enter there. Try to see what the difference between the void that we can see here to what we are getting here. In the mandible to inject all the void here. Don't be afraid to inject even a little bit more, and later on to massage it here, and then we will keep the injecting like in the other side to the lower part of the chi. Okay, that's enough. Okay, of course it's not enough. I'm keeping the cannula inside if it's possible. To screw very well back all the way the new serum. Inject deep to aspirate and to create kind of a fanning to inject 2 points. I'm not afraid that I see such a bump appearing in my injection area. I will need this material. I'm just going to the center of the bump and I'm pressing it down to the bone, and that's all. I will do the same here. All the material, and I need to add here a little bit more even. Stay, smile for a second. So I'm just injecting very superficially inside this wrinkle. It might look puffy for several days, but later on it gives a very nice result. It's quite gentle area. Actually everywhere when we inject superficial the skin,